All right, I want to go through another case with you guys. So let's get into it. So Isaac came to us. He's about 15, had a lot of concerns, alignment issues, bite issues, open bite. So it took us about 20 months to finish his case, end up with a beautiful result. So I want to share it with you guys. You can see here that, Isaac, when he smiles, things look pretty good. His incisors look a little bit off, like most kids before braces. But when you really get into this, you can see there's just a laundry list of items. He's got maxillary arch form issues. He's got a tapered upper arch, protrusion of the upper front teeth. They're inclined. You can see that they've got some chipping on the edges, and definitely a progressive open bite due to some vertical issues, as you can see in a downward and backward chin position, as well as just some convex facial profiles. Now, one of the issues you also notice is that his vertical position of his central incisor is pretty good. So, one of the objectives here is not to just erupt teeth into position. X-ray just confirms some of this. You can see these has mostly contact on his posterior teeth. Wisdom teeth are an issue, but we're going to manage those at the end of treatment. So when we look, we can see that we were able to treat him from beginning to end pretty nicely. We were able to obtain good arch form, good smile aesthetics. We do have a little bit of work to do post-treatment on some gingival leveling and maybe some incisor reshaping, but this is where we ended up, and he was really happy with it, so we wanted to kind of give him a break. Total treatment time was about 20 months. And again, one of the cool things about this case is that, we were able to blend both full expression system like Damon Ultima with Damon clear brackets. The objectives were the same. We wanted to use light passive self-ligation so that we can get some posterior development, get some of that space moving in the upper so we could retract the upper teeth. And then we were going to use our lift procedure to control the vertical and intrude posterior teeth, auto-rotate the mandible, and then use some elastics just to help with the smile arc initially. You can see 11 months into treatment, we have our 4 TADs in place for our lift protocol, which we've gone over in the last couple cases. It's just basically 4 8mm TADs placed between the second and first molar with buttons on the palatal, and then 60 grams of activated force repeated every 6 weeks so that we can get intrusion of the first molars and second molars, auto-rotation of the mandible, and then we can get bite closure in a very ideal way rather than just kind of a pure dental movement. So phase 1, again, is foundation and direction, which is exactly what we achieved here. I'm never really worried about how long phase 1 takes, as long as I'm in the right path. So if I've got all the teeth engaged, everything's looking good, bracket position is nice, the teeth are tracking to the right position, and I'm setting up the skeletal concerns. Again, if it takes me a year to get through phase 1, it's not an issue because I know that once I get into phase 2 and 3, everything should be set pretty nicely. So if we look at this, we started with an 014, went to an 018 in the upper, and then to a 140275. We took our time. I really wanted to make sure that as we progressed in the upper, I began tying those TADs at about 140275. I didn't want to put the TADs in too soon because when you do that, unfortunately on the buckle of the 7 and the 6, you can get a little bit of unwanted tooth movement with the wire bending rather than the wire fully intruding the buckle of those teeth. We did start him on some 334 elastics, and then as he started to auto-rotate, we expected this, he moved into a little bit of a class 3, so we just started wearing some light class 3 elastics, right and left, picked up his 7s, and away we went. So again, 11 months in phase 1, we look at this looking pretty nice. Now again, from here, we know how this works with our 3-phase approach. We went ahead and put in 180275 copper nine ties, continue to tie his TADs. I did use some tongue tamers here because his tongue was getting in the way, and you could see how nicely those worked. I just put them on the upper laterals and the lower laterals just so that I could get that tongue back and trying to rest in the upper portion of his mouth. Now, when you have a tapered arch form for so long, it's just habitual for your tongue to lay down into the lower floor of your mouth. So a lot of this was just to really get it up and get it kind of away from the teeth, right up into that palate. And it seemed to work quite nicely with the rest of his vertical control. So this took about 3 months. Now we're moving on to full expression. So 180275 copper nine ties went in upper and lower, continued as class 3s. We repositioned a couple brackets in the middle of phase 2, and now we're ready to finish this case. So as we move out of expression and optimization at 14 months, now we're going to go ahead and put in his final arch wires. Again, I kept the TADs in just because I wanted to make sure that I finished him a little bit overcorrected. It got as much vertical change as possible. They were stable, they were good, they weren't bothering him, so I tied those until I really didn't have much contact in the posterior. Again, you can see now from phase 2 to phase 3, it was about 6 months just because the anterior teeth were clear brackets. I didn't have a full expression system, and I had to do a little bit of detailing with bending the arch wire, which is common, and that's fine. Again, we use TMAs since I was doing some detailing. I don't like to bend on steel wires, and especially not with ceramic brackets because it can cause some issues. Kept them in a 160275 steel in the bottom, let those class 3 elastics work, and we were finished up about a week later for a total of about 20 months. Now, we can see here that we didn't really have to change much of his smile arc. We improved it a little bit, but most importantly, and he wasn't biting down that picture, we're able to achieve a beautiful occlusion without over-eruption of the incisors. And if you look at the periodontal health of those lower anterior teeth, they look way better than they did pre-treatment. And most of that is because as we got buccal uprighting, we're able to get some retraction with those class 3 elastics. And as the teeth auto-rotated with the upward development, we got some retraction of those upper front teeth as well. If we look at this just in kind of a before and after kind of setting, you can see, again, the 20 months went quite nicely. Everything was treated beautifully. And I'm really happy with how this open bite treated out, simply because it's not just stretching teeth. It's actually fixing the foundational problem, which is the vertical portion of his over-eruption. Really, really nice arch form for tongue position. Breathing improved for him, at least that's what he reported. Took out the TADs, finished things up in 20 months, and away we go. So if we go ahead and we look at some of this, we can see from an x-ray standpoint, things look great. In hindsight, probably would have taken out those wisdom teeth a little bit sooner, but he's going to go ahead and have those taken out post-treatment, and then we'll let the second molars erupt a little bit better and watch them through retention. Again, when we look at this, we can see that, really, really nice facial aesthetics, really nice improvement in his profile, good macro aesthetics, good mini and micro aesthetics. You can see, again, I do think that we recommended that we want to go back with a little bit of a laser trim up that upper left central and maybe do a little bit of edge recontouring. And I'm sure they did that, but this is kind of where I have his final pictures a day after removal, and things look great. So, really nice case. I think it just shows the power of treating the vertical properly, using the braces to get some posterior development through this nice idea of light forces. And again, really, really treated well. So if you like this case, definitely keep checking us out, like and follow, send this to some friends. So hopefully you guys enjoy this, and watch out for our next case. Thanks a lot. Bye-bye.